My name's Tonya Conley, and I am the radiology supervisor of Fairfax Hospital. My typical day is to guide my technologists through exams. I make sure that they do patient care, I make sure I do scheduling, I do meetings. I make our hospital better every day.
Okay. I'm just gonna put I'm not pushing.
Better not be. I always wanted to be in the medical field. I am very good with patient care. I care about my patients, and I wanted a small section of the hospital. I did not want to be in nursing, and this is a field that allows you to help patients, help save lives, and to see really cool stuff. We are a hospital, a 25 bed, it's very small, but we do patients of size. There's a lot of lifting and moving, and some patients don't do well being lifted in the air and moved. So we have a tech that usually is with the patient at all times, unless we're scanning. The other technician is behind the computer. We work together really well. We know the entire job, so when one person's doing one job, the other person just takes over and helps out.
My name is Angela Hetherington. I work at Radiology as a tech. I'm just gonna line you up a little bit, get you real straight. What you're gonna do is roll your shoulders in. I went to school at Meridian Technology Center. I loved it, it was great, it was a great program. Hold it out, don't breathe or move. I've worked at bigger hospitals in other parts of Oklahoma. This is where I've been for the last 4.5 years. I love it here. It's very rural, very small, but we're like a little family. We help each other, and you get to know everybody really well. We can rely on each other, and they feel that when they come. And they always make comments about how friendly we are to one another, which is a good thing to be. The other thing I've noticed with rural hospitals is because you are traveling so far, the compensation is much higher. I've worked at a big hospital, and I've also worked at a small rural hospital, and the pay was actually better at a rural hospital. We have a bariatric unit here, so we lift a lot of patients, and we have to have a lot of help for that. We have a couple of different modalities. We have x-ray here. We also have CT, CAT scans. We do ultrasound as well. Critical thinking is a very big thing. Accountability is a very big thing. You have to know kind of what to do and what your next step's gonna be. Have a system. Patient care is a huge thing. You have to be good at patient care. You have to be able to talk to your patient while they're going through through pain that they've maybe never had in their lifetime. For going to a technology school and only going to school for 2 to 3 years, coming out, you make a very great salary. It's a very desirable salary, and you get full-time benefits, which is a huge thing. A lot of people haven't even had insurance before they come out of school. So the benefits of working at a place like in rural areas like this, you do make a little bit more because it's hard to get people to come because we're so far away from everywhere. But here we have such a great family structure that it's wonderful, and the benefits are your compensation is huge.
You see patients on a regular basis. It's a hometown feel. So you have to have the empathy, you have to have the caring attitude. We want somebody that's reliable because it takes me longer to get here from the town I live in, so I don't have time to run up here because you don't show up. So this is a career, this isn't your average job. We rely on people.